They may have been that person at the grocery store, a friend, a loved one. Tonight, 1 year into the COVID-19 pandemic in Iowa, we hear words of grief.
I'm never going to get to talk to my mom again, ever.
Of heartache.
My mother was very angry on her deathbed. She was very angry that this was happening to her.
Hospital workers fighting to save lives share what it was navigating the unknown. And we honor the hidden healthcare heroes keeping us alive. Coronavirus Cause and Effect, Iowa Impact, Episode 3. You're watching Local 5 News.
Well, as of tonight, over 5,500 Iowans have died from COVID-19. Every single one of those people has left an impact and has a story. Behind each person lost is a family who has dealt with unthinkable pain. Tonight, Local 5's Eva Anderson shares the story of a woman who left behind a powerful legacy and her daughter who is grappling with grief, knowing she's just one of thousands who feel the same.
My mom was somebody who showed her love through her actions.
Somebody who will forever inspire her daughter, Erin.
Whenever she saw a problem that she could solve, nothing was going to stand in her way.
Nicole Keller was a trailblazer, a leader at Principal Financial Group starting in the 1980s, eventually helping take the company public on the New York Stock Exchange.
I remember seeing her in her power suit going to Principal Financial Group when I was a little girl and thinking how she must be so important and how I wanted to be important when I grew up. And I wanted to have that kind of implicit respect that she worked hard to get because she was a woman in a predominantly male corporate environment.
But her impact extended beyond the workplace. In addition to being a loving wife, mother, grandmother, she was a dedicated volunteer and activist. After she retired, helping create the health insurance co-op for the state of Iowa. Then, with her daughter, conducting a research study for the National Alliance on Mental Illness. She was also an advocate for the arts in Waukee because of Erin.
She was on the building committee for the first high school in Waukee School District to have an auditorium. She did that because I'm a singer, and she wanted me to have an auditorium to sing in, and so I did.
The innumerable ways Nikki showed love for her family and the community make it that much harder for Erin to know her mother's gone, especially in Erin's time of need.
I'm never going to get to talk to my mom again, ever. And she was a really great person to talk to. I don't get to hear any new ideas from her. I don't get to process what's happening in our country right now with her. I don't get to be inspired by her. And I don't have her to care for me, and I have cancer, and she was the person who really knew how to take care of me. And she's gone.
Through her pain, Erin has perspective.
And I am one person out of thousands.
Over 5,000 Iowa families are grieving just like the Kellers. Over 500,000 nationwide. It's made them angry. It made Nikki angry before she died.
My mother was very angry on her deathbed. She was very angry that this was happening to her and that she was going to miss her granddaughter's high school graduation. She was very angry with Trump, with the coronavirus response, and with people's stubbornness in not wearing masks and not socially distancing and not staying home and having that take her life.
That sentiment is something Erin's family included in her mother's obituary. It reads in part, quote, Nicole Keller passed, succumbing to COVID. She is gone now because of the lies and incompetence of the people in power who were elected to protect us, unquote.
Knowing who my mother was, what she stood for, and what she taught, to me it wasn't an option. It had to be in there to honor her
Nikki Keller's memory lives on in her family, and Erin hopes to continue her mother's legacy.
One of the last things she said to me before she died was that I had to go out and make the world a better place. So I hope to fulfill that wish of hers.
And that was Local 5's Eva Anderson reporting there. And it has been a tough year on our healthcare workers, working long hours and putting their own lives at risk to care for those with COVID-19. Local 5's Khalil Maycock shares what 2 doctors on the front lines are dealing with.
That fear of the unknown, that fear of how big will the numbers get.
It was a mixed feeling of fear, honestly, anxiety, and uncertainty.
Feelings 2 Metro doctors had working on the front lines of the pandemic. Dr. Jason Cruz with Broadlawns Medical Center says some of the early days of that fight are blurry, but he remembers his hospital talking of doubling capacity if needed and potentially splitting ventilators.
Just thinking of all kind of the worst case scenarios.
But the worst case scenario for Dr. Patrick Oben of Mercy One was not knowing how to help his patients.
We had no idea what this virus was. Then no information, nothing in the textbooks, no guidance. We had no idea how to diagnose it. But when you don't even know what to do with respect to diagnosis and therapy, you're paralyzed.
As time went on and Iowa neared its first peak, Dr. Cruz says he began to get concerned with how would he stay protected from the virus.
We didn't have a lot of confidence necessarily in our personal protective gear. You're seeing pictures of people around the world who are duct taped into Tyvek suits, and we had 3D printed face shields and masks that we've been wearing for a week.
Not having the right gear and trying to stay safe led both doctors to alter their lives outside of work.
I was sleeping in the basement, staying separate from my wife. I got young kids at home, and we'd still see them and still be around, but it was less excited to come and give them a big hug coming in the door.
And coronavirus and the death it caused took a toll on the doctor's mental state.
You know, the public thinks, well, doctors are professionals. You guys are tough. You're superheroes. I'll say we are not. We are not superheroes. Those things have an emotional impact on us.
To relieve that emotional impact, Dr. Oben spoke with his family, and other hospitals provided a different outlet.
Having a chaplain go around and checking on staff is just kind of a calming effect. It has the effect of saying, look, we know that this is not an easy time right now, but we're going to make it through.
It's a year later, and both doctors are looking to the future.
I recognize that everyone has had a hard year. Stay patient, and we'll get through this together.
Khalil Maycock, Local 5 News, we are Iowa.
And weeks after Iowa's first novel coronavirus case, state leaders confirmed the first COVID death. We've shared the data daily for nearly a year now. Local 5's Holly Schlesselman dives into the data and the importance behind each number.
I spent the last year looking through a lot of numbers, and I'll admit I've had to step away to compose myself. Because behind every number, there is a human being, an Iowan. But understanding how this data matters when it comes to reporting deaths is critical for Iowans now and in the future.
March 24th, 2020. An older adult between the ages of 61 and 80 from Dubuque County is the first Iowan to die from COVID-19. Monthly totals exceeded hundreds, then thousands. Reporting these deaths made difficult because of how new the novel coronavirus was.
When you think about COVID and the pandemic response, there were so many things that we've done so quickly, systems that never existed before, tests that never existed before, things that we didn't have that we had to develop and have developed in a really remarkable period of time.
Let's go back to how Iowa first reported deaths. Most related to the virus haven't required examination by the state medical examiner's office, usually because the individual had a confirmed positive test. We found this out in August, after Iowa confirmed the first child death from the virus. The child died in June, but the state didn't finish their investigation until August. The Public Health Department spokeswoman told us, quote, "There is a broad range of complexity and length of time it takes to finalize a report, both in infant-child cases and adult cases. In 2019, the average time to report an infant death with similar types of testing took 60 days. For an adult that didn't require testing, 31 days. And that's just for determining cause of death. Once that is confirmed, it can take up to 10 days after someone dies to report their death to the National Center for Health Statistics. At first, the state required a positive test of a deceased person and case information to determine if someone did die from the virus. Now, a positive test isn't required. This update came in December when the CDC announced a new code for categorizing COVID deaths.
And so making our death reporting align better with the way that we report deaths from other diseases, I think helps make this a little bit better understandable for what's going on in Iowa, as well as being able to compare what's going on in Iowa with other states.
As Dr. Padati just said, death data will help Iowans in the future understand how the virus impacted Iowans compared to other illnesses, like the flu. Adjusting how data is reported when new information or resources are available is important for how we move forward. In the studio, Holly Slusselman, Local 5 News, we are Iowa.
Unsung heroes of the pandemic, hospital janitors, how one Marshalltown cleaner keeps going despite facing the virus every day. Welcome back. Long haulers, as they're called, are often not a part of COVID-19 coverage over the past year. They are people who have had coronavirus, recovered, but are still dealing with the various side effects of this disease. Local 5's Rachel Droz reports on how one Iowan's life has changed.
Willie Farrell,
Rachel, I'm Willie.
a Des Moines comedian, had COVID last March.
It was 2 weeks of a cough that I can't even tell you how bad it was.
As Willie started feeling better, 2 symptoms stuck around. 1 year later, he still can't taste or smell.
The 2 ENT guys I went and saw both kind of wrote me off as there's a 90% chance you're not going to smell again.
We decided to come here to G-Migs to put Willie's taste buds to the test. We have 4 different wing sauces in front of us, and Willie, let's just start with the most mild.
All right, we'll go with the barbecue here.
Even eating the hottest sauce at the Valley Junction restaurant, Willie didn't break a sweat.
Okay, my mouth is kind of hot because of but I'm not tasting anything.
His reaction made me wonder, how spicy is that sauce? So,
It's spicy.
I gave it a try.
So if anybody doesn't believe
Like my mouth is on fire.
Yeah.
Willie is considered a long hauler, which by definition means he's had COVID-19 symptoms longer than 28 days.
Since we don't know the exact mechanism of what's causing this, there's no specific treatment.
Dr. Ravi Vamuri, Director of Infection Prevention at Mercy One Des Moines, says long haulers present with a wide variety of symptoms.
The vast majority of these so-called long haulers are people that aren't hospitalized and that have relatively mild illness.
The National Institutes of Health announced last month they've started studying why some people have lingering COVID-19 symptoms and others do not. Rachel Droz, Local 5 News, we are Iowa.
Well, some studies have shown up to 30% of lingering COVID symptoms that can last months, according to the Mayo Clinic. And the most common long hauler symptoms include fatigue, shortness of breath, cough, joint pain, and chest pain. Well, whenever someone in your life dies, celebrating their life at a funeral is a big part of the grieving process. But since the pandemic began a year ago, hundreds of Iowans have indefinitely postponed funerals for fear they will be at risk of getting or spreading the same virus that took the life of their loved one. Local 5's Eva Anderson shares how these families can feel in a suspended state of grief.
Most people's lives are marked by a series of celebrations, and hopefully with each celebration, a gathering of those who care so much about you. The day you're born, a joyous gathering. If you're lucky, then a gathering of people each year after that. Celebrations the day you graduate, marry, have your first child. All those special moments that are shared, surrounded by other people who love you. As the years go on, the birthdays, the big ones, become even more of a reason to celebrate. You've built a life that's touched so many people, they all want to celebrate with you and celebrate you. So after your final days, a final celebration of your life brings it all full circle. And then, the pandemic. The last celebration, the one that's supposed to be the culmination of all of those other moments, doesn't happen. There's no one to celebrate the soul that is lost. They're alone.
Now it happens all the time, just all the time.
Laura Lundberg has a backlog of uncelebrated souls, deceased Iowans whose loved ones were never able to safely gather and tell them goodbye and reminisce.
When you don't have that, there's something absolutely missing if you don't have some kind of gathering or celebration, because it just feels incomplete, it feels wrong.
Some, even a year later, are still waiting to have that celebration. There's no closure for the loved ones. And for those who may have spent their final hours not even able to hold the hands of anyone they knew, maybe there's no closure for them either.
You want to know that your family and your loved ones were able to gather and get together and celebrate you.
It's so hard for these families, and Eva, you have a personal connection to this.
Yes, you can see her picture there. That's my grandmother, Marilyn June Anderson. She died in September from COVID-19, and she was generous and loving and feisty, and you could hear her laugh wherever you went, and she was an avid community volunteer. And even though she died 8 months ago, we still haven't held a funeral to celebrate all those things about her. But I know my family's not alone. If you have a loved one who died of COVID, you can honor them online. My grandma's now online on a website, iowacovidmemorial.org. You can see it scrolling right there. Stephanie?
Well, even knowing you and hearing all the things you said about your grandmother, I know it's all true. We thank you so much for that report and for sharing your story with us. We'll be right back. There certainly aren't enough words to describe the appreciation we all have for healthcare workers. Over the past year, they have sacrificed their time, their bodies, and their lives to help. Tonight, a look at others inside a hospital who make it all work. It's part of our special segment, Pandemic Heroes, from Local 5 photojournalist Eric Gooden.
When it first hit here, it was just like crazy. I mean, everyone was totally in fear, scared, didn't know what to do. I work in ENS, and what I do is I'm strictly the ER, so I go around and clean the rooms. It's very hard work, I'm going to be honest with you. Being down here in the ER, you go home at night and you're really, really tired. You definitely want to make sure your handles are wiped down. We always want to make sure that our screens are wiped down and our monitors, because they're used by nurses for every patient. If they didn't have us ENS workers, the hospital wouldn't be clean at all. There's a lot of germs that come in and out, a lot of sickness and everything, so you pretty much need us. Now you kind of have to step up a little more and really try harder to make sure that all the germs and everything are killed and that you get the COVID out of the way. What I'm using here is Oxycide. It's a really strong killer. It pretty much kills everything there is. I don't really classify myself as a hero. I kind of feel that I was kind of like called to do this. The longer I'm here, I feel like I make more and more of a difference in people's lives. I've learned that I can be strong through anything. I mean, you just got to keep going, even some days when you don't feel like, you want to come to work because, what are you going to run into? Are you going to get sick and stuff? But you just keep going. I'm finished up with this COVID room and I'm moving on to the next one.